Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Stroke. So what is stroke? The first investigation will be always the NCCT. So NCT in stroke is the first investigation. Now let's look at the hemorrhagic stroke. So hemorrhagic stroke, there is presence of the hyperdense area. And this is nothing but MC, that is the most common cause in case of the HTN, that is a hypertension. Then moving on to the basal ganglia. The basal ganglia is nothing but it is the MC, that is the most common site. So most common site being the basal ganglia. Next, let's look at the infarct. Under the infarct, there is a well-dense hypodense area. So well-defined hypodense. So there is presence of the hypodense area. There is loss of gray matter, which is seen, and there is also the white matter, a differentiation which is also seen. Then the well-defined vascular territory is seen, vascular territory, this is also seen. There is a left middle cerebral artery territory, So this is seen in right hemiplegia. Then we move on to the lacunar stroke. The lacunar stroke, there is again the hyperdensity is seen. This is within that of the thalamus. There is presence of the lenticulostriate branches. This is on the MCA, that is the middle cerebral artery. Now what about the acute infarct sign? The acute infarct sign, it includes the presence of the hyperdense MCS sign. So hyperdense MCS sign, it includes the NCCT. NCCT, it shows a white middle cerebral artery. So white middle cerebral artery is seen, and also the dense thrombus within the vessel. So dense thrombus is seen within the vessel. Next we move on to the insular ribbon sign. The insular ribbon sign is there is a hypodense insula, as well as the normal insular ribbon lost. The normal insular ribbon, it is lost. Next we move on to the middle cerebral artery infarct. So middle cerebral artery infarct, then comes the light bulb sign. The light bulb sign is nothing but an acute infarct. It appears bright on the DWI, that is a diffusion weighted imaging. It appears dark on the ADC. That is apparent diffuse coefficient, and there is also presence of the puff of smoke. The puff of smoke sign. To learn and grow daily like this, please do subscribe.